Hello, and welcome to this interactive video on Diabetes Made Simple. You have been chosen to view this short video as you may be or are in supervision of diabetic children. Statistics along with your recent pre-survey, 42% of you stated that you were not confident at all in your diabetes knowledge, and 38% said that they were somewhat knowledgeable. 52% of you stated you did not feel comfortable helping in a diabetic emergency. During this video, it is hoped that your baseline knowledge of diabetes will be increased, that your confidence will grow on the topic of diabetes or an emergent diabetic event. We will start off on the prevalence of diabetes in the United States. By definition, school-aged children are from the ages of 6 to 12 years old. A psychosocialist analyst, Erik Erikson, states these children are in the stages of industry versus inferiority. This means that they still need help but are on their way to independence. If diabetes is understood by everyone in supervision of the diabetic child, this will ultimately promote a long, healthy life, minimizing complications. During the last 3 decades, the incidence of diabetes has dramatically increased amongst school-aged children. In 2009, 192,000 children were diagnosed, and in 2011, 208,000 were diagnosed. Thus, it's important for all schools to take a unanimous stance to help combat this disease and prepare for a continuing rise in epidemic of school-aged children diagnosed with diabetes. In order to facilitate appropriate care of the student with diabetes, it is thought those of supervision of the child must have a general understanding of diabetes, be educated on its basic management and symptoms of life-threatening diabetic emergencies. Food is made up of 3 basic substances: carbohydrates, also known as sugars, proteins, and fats. In order to understand the basics of diabetes, you must know the role of carbohydrates in metabolism. Normally, when sugar is consumed, it travels from the stomach to the bloodstream. At this point, it enters into the muscle and fat cells to produce fuel for the body. Insulin is a hormone created by the pancreas organ that acts as a key to allow sugar to enter the muscle and fat cells. These cells then can regulate and normalize blood sugar if this process is not interrupted. So what is diabetes? It is when the normal process of sugar traveling into the muscle and fat cells is interrupted. There are 2 ways this can occur. The first way is that the pancreas does not secrete enough insulin. This is type 1 diabetes. The second way is when insulin produced by the pancreas does not respond. This is type 2 diabetes. All known diabetics will have their hemoglobin A1C drawn, as this is drawn to show a 6 to 12 week synopsis of their blood sugar control. Depending on the type of diabetes someone has, their blood sugar is regulated differently. In type 1, the individual is not making insulin, therefore needs to receive insulin supplementation through injections, or nowadays commonly an implantable insulin pump. In type 2 diabetes, where there is insulin produced, however the pancreas is not responding, diet management, exercise, oral medications, and insulin can be used. A specific care management guide should be formulated by family and a physician that regulates the patient's blood sugar. This plan should always be given to those in supervision of a child with diabetes. There are many risk factors for diabetes. Risk factors for type 1 diabetes is a genetic history or a family member with diabetes, and for type 2, a family history, obesity, poor diet, and physical inactivity are all risk factors. Note that factors such as obesity, physical activity, and diet are all preventable. Now that you know what insulin is and that it decreases blood sugar, there are 3 different types of insulin: rapid acting, intermediate acting, and long acting. Rapid acting is the quickest, where results from the medication are typically noted within 15 to 30 minutes. Regulating blood sugar and frequent blood sugar checks are extremely important. Poor blood sugar can result in kidney failure, heart attacks, strokes, amputations, feet infections, pain, numbness, tingling, and blindness. If blood sugar is regulated well early in life in all environments of the child's life, these complications can be minimized. Going forth, symptoms such as frequent hunger, thirst, fatigue, dry mouth, urinary frequency, blurred vision, or nausea can all be present in undiagnosed diabetes. If these symptoms are exhibited by a child, they should be recognized earlier than later. Through knowing this knowledge, suspicion could rise if a child has had these symptoms, and thus their health can be managed better in preventing serious diabetes complications. You may wonder what hypo and hyperglycemia mean when you see them. Hyperglycemia is simply the medical term for high blood sugar. The blood sugar will be greater than 120. Hypoglycemia means the child's blood sugar is too low, lower than 70. What are the signs of hypoglycemia? The child may be shaky, complain of dizziness. They may have headaches, become sweaty, irritable, have pale-like skin, or seizure-like activity. Low blood sugar can be caused from the common stomach flu, lack of food, strenuous exercise, or taking too much of their medicines. Too low blood sugar can actually cause brain injuries and even deaths. Low blood sugar can be prevented in diabetics through frequent snacks, careful monitoring of medications, a proper diabetic management plan in all environments such as school, daycare, and extracurricular activities, good communication amongst all in supervision of a child, and knowing the cues of a blood sugar that is on the urge of being too low is vital. On the other side of the spectrum, too high of blood sugar can cause the child to have symptoms of thirst, frequent urination, irritability, lethargy, blurry vision, weight loss, or persistent vomiting. Too high of blood sugar in diabetics can be caused by not taking their medications, not following a healthy diet, inactivity, infections, steroids, and emotional stress. If you are a person who learns better through pictures rather than lectures, here shows the differences in symptoms of high and low blood sugar that we discussed. All diabetic individuals should be followed by a dietitian and should be on a strict diet for proper blood sugar control. A diabetes diet simply means eating the healthiest foods in moderate amounts and sticking to regular meal times. A diabetes diet is low in carbohydrates, fat, and calories. In fact, a diabetes diet is the best eating plan for most everyone. A diabetic should be recommended to eat simple carbohydrates such as fruits, whole grains. They should focus on vegetables, proteins, fibrous foods such as nuts, beans, and peas, fish such as salmon, mackerel, tuna, and sardines. Diabetic individuals should avoid saturated fats, starches, trans fats, cholesterol, and sodium. Foods highest in sugars are baked potatoes, pasta, butter, syrups, sweeteners, cereals, bread, pizza, soda, sweetened or unsweetened fruit juice. All diabetic individuals should limit their diet to 10% saturated fats to avoid heart complications. These common day items in our grocery stores are whole milk, 2% milk, ice cream, cheeses, ground beef, hot dog, sausage, bacon, butter, gravy, and chocolates. Recognizing an emergency related to diabetes is important in any environment as it is a life-threatening event. If the blood sugar of a patient is severely elevated, the child may exhibit short, rapid breathing, fruity breath, or they may be unconscious. Severely elevated blood pressure can lead to life-threatening events such as diabetic coma and ketoacidosis. Extremely low blood sugars can also cause coma, unconsciousness, and seizures. Knowing the signs of diabetic emergency could help save a patient's life. Even if you don't know what to do in an event, seeking help is what matters. Based on the Americans with Disability Act and the Disabilities in Education Act, no diabetic child should be restricted from educational opportunities. They should not have any restrictions. However, they may be required accommodations when necessary for their well-being. If you suspect a high or low blood sugar, best testing is completed through a 5 to 10-second blood test. If a low blood sugar is suspected in a diabetic, 3 hard candies, a half cup of orange juice, and 1 cup of skim milk are acceptable to give the patient. A good rule to know: never should soft drinks be used to increase blood sugars. As an individual, you may be or are currently in supervision of a diabetic child. Your role here is clear. Having a baseline knowledge of diabetes may increase your confidence in knowing the first steps what to do in emergent diabetic-related events. If you do not know what to do, you can at least understand the trigger cues of a high and low blood sugar and seek immediate help. Management of health through encouraging healthy diets and physical activity of the child are something you can do every day. Thank you for watching this video. I hope each viewer has gained the confidence in their baseline knowledge of diabetes. You may watch it and share it with whomever you'd like. It will be available to review until December 15 at 11:59 p.m. and a post-test will follow. If you have any questions, concerns, or need clarification, please contact the following.